let's get to it so we can I can try to stay on track. So what are we talking about when I'm talking about this big lie? Hey, Stephanie, great to have you here. Happy Wednesday to you. Well, it comes down to bulging discs and them creating pain in the spine. So to understand this, because a lot of times doctors are going to tell you, orthopedic surgeons like, oh, I just have a bulging disc, you know, it's no big deal. Well, it is a big deal. And if you understand anatomy and physiology, the structure and function is what those two terms mean: anatomy, structure, physiology, function. Okay, and structure dictates function when you study anatomy. If you understand those terms, you're going to understand what I'm talking about, how a bulging disc can actually cause pain. But the first thing you got to do is you got to understand like what a bulging disc is. And just so you know, hey, if you're suffering with back pain, I want you to know I've been there too, and I know what it's like. And here's a picture of my back when I messed it up really bad at a skateboard park. So I've walked in your shoes, and I want you to know I understand how you're feeling, and I'm here to help you. Okay. So what do you have to know about this? Well, let's take a look at a disc. So you're looking down at a disc, and just so you can see this model right here. And so you're looking straight down like this. There'll be the spinal cord. You'll have a nerve branch that comes out to one side and to the other, and that happens 31 times as we go down our spinal column. So here's the disc right here. This is one of your nerve branches in yellow that you see over here. And this is the main things that you need to know about it. And you'll have that same thing happening over here. You're going to have a nerve branch coming out like that. Okay. When a disc is healthy in the low back, the only exception really to this is at L5. You usually won't see it quite as much. But when you look at the back of the disc, it should have this arch to it, like you're seeing me draw in red right here. Super important. So if I show you a model again, right, and you're looking right here, you're going to see this arch right there. Okay, so it's not flat going across. It has that archway, and that arch has the reason it's arched is because of a thing called the PLL, or the posterior longitudinal ligament. What's a ligament? Well, a ligament is a really strong structure that typically connects bone to bone. And so it creates this very strong retaining wall right here so that this jelly that is in this area can't really migrate and push onto the nerve branches or to your spinal cord, without getting too technical about this today. And so that's what that's supposed to do. So when everything's working correctly, that's what's supposed to happen for you. So let's look at an MRI. So we're looking at the exact same thing we just looked at, but now we're looking at an MRI picture of it. So here is your disc right there. Okay, your belly button would be, like way further than that, except I can't draw it any higher than that. All right, this right here is what's called your thecal sac. It's the covering around your spinal cord. And then where you see this purple line at here, this is the nerve branch. That branches off to one side. This would be your left one because it's opposite of the picture. And then this would be your right one over here. So first thing I do when I look at this disc right here is I know that this disc is actually bulging. And the big reason is because at L4, there should be an arch to the back of this disc right here, and it's not. And so when it's bulging, what it's doing is instead of the disc, which is this structure, should be the same exact shape of the bone, when it starts to tear on the inside, what happens is that disc, with the weight of your body, as your weight of your body starts to come down and compress it, it can't hold itself in, and so it starts to bulge out just like that. It's kind of like an old tire in your car, and you got a weak area on it, and that air pressure is constantly pushing against it, and then you start getting like a bubble, okay, that pushes out. So that's a bulging disc. And the difference between a bulging disc and a herniated disc, it's almost the same, except the only difference in that is that when it herniates, instead of that red jelly staying on the inside, if it starts to protrude out like that, we go to a herniation. So if the jelly stays on the inside, it's a disc bulge. If it starts to push out It's called a disc herniation, without getting too technical about it. But it's a really common question I get. So here we know that we have some sort of an issue with the disc. But here's why you can get pain with a disc bulge. So we're looking pretty much similar here in pictures. This is the jelly, the purple part. But when you get a disc bulge or herniation, what's happening is you're getting tears to these layers called the annulus fibrosus. And so these are all torn in here. It's allowing this jelly to migrate and protrude or push outward. If it stays within the disc, even though it's torn, that's going to be a bulge again. And that's why this is a lie. So why is it a lie? Because you see all these little yellow things right here? Those are called nociceptors. And nociceptors mean pain sensors. So just like if you skin your knee, or your kid falls on his bike and skins his knee, and that's bleeding and oozing, the same exact thing happens to us in our bodies. And what winds up happening at that point is the chemicals, the fluid that leaks out of here irritates the crap out of these yellow parts that are pain receptors, and it causes pain in your low back from the disc. And that's how you can get low back pain from a bulging disc that most people will minimize, and most orthopedic surgeons will tell you, it's not really going to cause you any back pain because they're looking for bigger things. And yet I've seen a lot of my patients over the years that come in with bulging discs that mechanically and anatomically don't look that big, but they're in a ton of pain. And this is why they're in a ton of pain. It's because these little sensors are getting constantly irritated by these chemicals that are oozing out of the torn disc. Does that make sense? Okay, good. I'm glad. If you have questions about that, happy to explain it a little bit more. So that's why it's a lie, that a bulging disc really can't cause back pain, because they can, and there's lots of anatomical evidence that that is the case. So I hope that helps you. If you have somebody that is suffering with back pain, who has a bulging disc, even if they're not herniated, and yet no one's really given them answers and they're still suffering, I want you to know that this is a major reason why people can have back pain with bulging discs. If they would like to do a discovery call with me for 10 to 15 minutes, I'd be happy to talk with them. And it's an opportunity for me to kind of hear, what they're suffering with, perhaps maybe go over some imaging with them and try to shine a positive light into their life and maybe give them some hope that they can get better. Because you remember, if you've been with me for any time, our success rate, and most of the research shows 88+% success rate doing this non-surgically. So if they're looking for a non-surgical option to manage this, that's what we provide. So, but would love to chat and see if we could help point them in the right direction. So I hope you'll share this with them. Hope you'll share this with people that are suffering. Unfortunately, every other person you come across in the United States has back pain or will have back pain at some point in their life. Did you know that? So there's a lot of people out there that are suffering silently. And, as you can see, like Marisa is saying, her son got into a car accident, has a bulging disc. And, he's less than 21 years old. So this stuff happens. I've seen it a lot, and it's happening younger and younger, and you're going to see it a lot in the neck because of the way everyone's holding their phones and looking down at them. So just keep that in mind. And we're here to help you, teach you how to correct these things non-surgically and from the comfort of your home. So it's always a pleasure having everybody here. Thank you for the input. Stephanie, always great to have you here, and everybody else that joins us. I hope this added some value to your life. I hope you'll share. Write me a comment. Let me know what you think about this. If you thought it was interesting, I would love to hear about it. And if you're an orthopedic surgeon and you think I'm full of crap, yeah, let's have a conversation. But anatomy is anatomy. Doesn't matter if you're an orthopedic surgeon or a chiro or a nurse or whatever. We all study the same books. And the body hasn't really changed that much. So, but always open for those conversations. So hope you have a great day. We'll see you here next week. And same time, same channel. Thanks, everybody. Love and appreciate you.